Food allergies in children are an increasing occurrence in the United States. Peanut allergies in particular have doubled in prevalence in the last 10 years. For years, experts thought that the best way to avoid food allergies was to delay introduction to those foods in the first years of life.
So the old teaching was avoid a lot of the allergenic foods early. The allergenic foods we used to describe were berries, shellfish, peanut butter, things like that. Now we've gone the extreme opposite. We're trying to introduce all those highly allergenic foods early.
8 foods account for 90% of all food allergic reactions: milk, eggs, peanuts, tree nuts such as almonds and cashews, wheat, soy, fish, and shellfish. The original guidelines for these foods varied, but introduction to all these foods were delayed until after first, second, or third birthdays. Those timelines are changing.
There have been some studies that have shown that in countries where they give highly allergenic foods, such as peanuts, that the rates of food allergies, and peanut allergies in particular, are dramatically less than what we have in the United States. And through those studies, we've really tried to change our practices.
2 studies found that there was a higher rate of wheat allergy in 5-year-olds who had not tried wheat until after 6 months of age. Various studies show that infants who ate eggs, peanut butter, or fish at an earlier age have a lower risk of allergy and allergic reactions than infants who ate it at a later age.
It turns out there in some countries, in particular in Israel, they were giving the children a snack called bamba, which is almost like a cheese doodle, but it's made out of peanuts. It's a peanut puff, we call it. And they were giving them as a chewing food or a biter food at the beginning of their eating experience. So maybe at 7, 8, 9 months of age. And the rate of peanut allergies was dramatically less in Israel than it was in the study compared them to children in London. And with that study and with other studies, such as the study in Scandinavia where they were using peanut oil in their formulas, we started to rethink how we were introducing the highly allergenic foods. And in the last few years, we've done a 180 in our approach to introducing the highly allergenic foods. The teaching now is introduce the allergenic foods early and often to potentially decrease the chance of food allergies.
There are still guidelines to introducing highly allergenic foods. A tolerance for basic foods such as cereals and vegetables should be established before introducing any highly allergenic foods. You should wait to introduce cow's milk until after the first birthday. However, that's for reasons outside of potential allergy. Milk-containing products such as baked goods and yogurts can be introduced earlier. Tree nuts and peanuts can be introduced as a butter or paste with the go-ahead from your pediatrician. Do this very carefully. There's still choking hazards. Any child who has a sibling with a peanut allergy is 7 times more likely to have an allergy, so he or she should be tested before introducing peanut products. The American Academy of Allergy, Asthma, and Immunology recommends that these highly allergenic foods be introduced at home rather than at a daycare or restaurant.
I think that it is reasonable to have some Benadryl in the house, just in case if there's some sort of allergic reaction. However, based on our new teachings, you're doing your child a huge service by introducing those highly allergenic foods early and often. I often will encourage my patients to, or the parents of my patients, to take a deep breath, take a big swallow, and just say, go ahead, introduce the highly allergenic foods.
If you have an antihistamine at the ready, then also be ready with the right dosage. The dosage depends on the child's weight, and young children can vary widely in size between 6 and 12 months of age. So make sure you've talked with your doctor about the appropriate dosing as your child grows, and hopefully your baby will grow to love a variety of foods. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.